I'm here today with Dr. Shane Speights because many people in our community are still not wearing a face covering when going out in public. Now, I know that many don't believe that it's not a dangerous thing not to do that, but science tells us even different. Some people don't care. Maybe they think it's brave somehow not to wear a mask, whatever it is. But I would ask that you make a choice today that this is a true thing, that we must wear our mask. And I'm suggesting that we not be fearful, that we walk with God, but at the same time, we've got to be fair on our decisions and not with fear. And so we are at our best when we're looking out for one another. And I think the simple truth is right now, the foreseeable future, we take care of one another the best way by wearing our mask in public. Now, you can still take it off when you're alone or with household members. You can take it off after you've been seated and had ordered at a restaurant. You can even take it off at work if you are at your desk and not too close to others. But I implore you to find a mask, put it on when you are around other folks in group settings. Distancing and frequent hand washing also are very important, but let's prove that we are strong enough to take care of one another.
Yes, sir. And I think that's the important piece, Mr. Mayor. And I appreciate your words and your encouragement on the mask wearing. I think people get confused, and sometimes even the science gets confusing when we talk about mask wearing. And the first thing people need to know is what type of mask we're talking about. You know, there's a difference between the surgical masks or the N95 masks that are used in the hospital setting, and of course the cloth mask, which we're encouraging people to wear out in public. And some of the science says, well, you know, that may not really protect me from getting the virus. And we're still working through some of that data and what that says. What we do know is that there's a larger and larger number of individuals who have the virus for a while and don't know it, specifically the younger and the middle-aged generation. So they can actively be spreading that virus to others and not know it and not feel bad at all. Or maybe it's very early for them and they don't feel bad for several days or up to a week before they really realize they have the virus. This can very much slow the spread of the virus. And the reason why is because even though a cloth mask is really not enough to hold the virus itself, it is enough to hold the respiratory or the water droplets that come out of your mouth and your nose, which is what's holding the virus. So the inside of that mask does prevent the spread from you spreading it on to other individuals unknowingly. And so that's really the biggest thing that we want people to understand and to know. Studies have shown that it significantly reduces someone who is sick in terms of their ability to spread the virus. You're only going to spread the virus maybe just a few feet by wearing a mask, as opposed to up to 30 feet if you're not wearing a mask. And we know more and more that virus can hang out in the air for up to several hours. So if everybody or a large number of people are wearing masks, we know that we'll catch a lot of people who don't realize they're sick from actually spreading it. So it can reduce the spread of the virus. Here in Northeast Arkansas, to be honest with you, we've been pretty lucky. We haven't been seeing the significant outbreaks that other places around the country and even around our state have had, such as Northwest Arkansas and now Central Arkansas. But I promise you, it's only going to take one inciting event for us to be in the same place that Northwest Arkansas and Central Arkansas are in. So we're really just kind of waiting to see, you know, if and when that event occurs in our area. I think for the most part, Northeast Arkansas has done a great job, and the citizens of Jonesboro have done a great job in terms of protecting each other and protecting ourselves from the spread of this virus. I think this is just an additional step that we can take to further reduce the risk and the spread of this virus. I don't think it's too much to ask of me or my family to do that when we're out in public, and that's why we wear masks. So I would echo what the mayor is saying right now in terms of those individuals who should wear masks out in public.
Right. Can you hear me, Dr. Spikes?
Yes, sir.
You know, the thing that I hear when I'm out and I'm visiting and going into various stores and stuff is that I see that maybe 10, 12%, 15% max is wearing a mask, yet I have mine on. And now I will say this, and I agree with you that our community has done a great job, particularly in your commercial area. They've put up the shields and things like that, and I think that's great. I went to Walgreens last night for something, and sure enough, there's the shield, and they did everything just right down to the T. So, but I just thought that you and I would want to give a message to our citizenry that it's very important to wear that mask. And I know that, you know, it's something new, but at the same time, when you see the numbers, and even though ours have not got, maybe say hit a big peak or a pike, something like that, we still have, you know, like, I don't know, what's the number, 300 or something cases now?
Yes, sir.
And are close to 400. And I know if you take that total of the state, it may be a small percentage, but for Jonesboro at 78,000, then again, we're looking at 2%, something like that. So I just want to make sure that you and I mean, as the mayor and the medical director, that we just remind folks that please wear your mask.
Yes, sir. Absolutely. I'd echo that. I think that's the right way to go. Certainly for those out in public, just for general citizens. I know that several organizations and universities, colleges, schools in the area are looking at how do we protect our students, our staff, and our faculty when we come back in the fall. I know just in my conversations with many of them that mask wearing is one of the things on the list, in addition to hand washing. And, you know, I want to go back to a reminder. This is a respiratory virus. This is how it's spread. It's spread through the nose and the mouth largely. And so if we can limit the spread of the virus, then we can protect those individuals at the highest risk. And again, those at the highest risk are anybody over the age of 65 or an underlying chronic medical condition, such as diabetes, high blood pressure, or any heart issues. So really, when you think about people that you know that might be in that category, it's probably quite a few people.
Right. And I'm amazed that when we started, when COVID-19 became a reality here, that your projections, you were right on target, because everybody thought that when the weather got warm and everything was going to be great and it would just go away. And you said it would not happen until June, middle of June or 1st of July, and you were right on target. So I thank you for that on your projections.
Yes, sir. And this is hard. It's a hard virus to project. And to be honest with you, the projections are largely dependent upon how people react to the virus and what they do to protect themselves. So right now, the projections we're looking at are what's going to happen this fall. And we do have some projections that, you know, probably the end of September, certainly into October. We're very much worried about that time period. So it's important that people get used to protecting themselves and their family now in preparation for this fall. Right.
I would just say to the folks, I think you probably concur, is just wear your mask and be Jonesboro strong.
Yes, sir. Absolutely.
Thank you so much for visiting with me today, and appreciate everything that you're doing, not only for the city or the county as a medical director, and your reports that we get every week. And I appreciate that very much.
Yes, sir. We appreciate your leadership, Mayor. I know this has been a tough time for anybody in your position. So thank you for what you've been doing.
Well, thank you very much, and I'll let you get back to your other projects.
Yes, sounds good.
Thank you.
Have a good day. Yes,
thank you. Same to you.